Hi, everyone, and welcome to another episode of Aila Health's Patient Spotlight series. I am here today with Amber Tresca, who was diagnosed with ulcerative colitis at the age of 16. And she is the founder of the About IBD blog and podcast and co-founder of IBD Moms. She is currently working as a speaker, facilitator, and advocate for people with IBD, as well as a freelance writer and editor for medical websites and publications. Amber, it is so wonderful to have you here with us today, and we're looking forward to hearing a bit more about your story.
Oh, it's my pleasure. Thank you so much for the invitation.
So maybe a great place to start is, if you could give us just a little sense of what your diagnosis journey has been like.
Right. So for my diagnosis journey, we have to go back 30 years. I was diagnosed with ulcerative colitis, and I began having all of the hallmark symptoms. You're talking, bloody diarrhea, pain, fatigue, weight loss. And it didn't take a huge amount of time, but I did have to go through several physicians before I finally saw a gastroenterologist. And that was the person that diagnosed me. It took long enough that I was quite ill, had lost a lot of weight. And at my first colonoscopy, which was used to diagnose me and is quite often used in the diagnostic process for IBD, I went into the hospital for that colonoscopy and didn't leave for 40 days. So that was the beginning of the journey. Lots of ups and downs over the next 10 years. But what ultimately happened is that I was sick pretty consistently over those 10 years with unrelenting inflammation. We didn't have a lot of treatment options in those days. It was the pre-biologic age. And what finally ended up happening at my last colonoscopy was that they found signs of dysplasia in my colon, which meant that there was precancerous changes. And given what a poor state my colon was in and the changes that were occurring in the cells there, we decided that it was time for surgery. So when I was 26, I had a 2-step J-pouch surgery, which the first step is the removal of the colon, so a colectomy, and part of my rectum. I still have a little rectum left, and the creation of a J-pouch, which is where they take the last part of your small intestine, the terminal ileum, and sort of fold it over and staple it back onto itself, or hand sew it back onto itself and make something that looks like a J, and then that functions as your rectum, instead of in place of the rectum that they just removed. And the second step also in that is an ileostomy is placed. So I had 3 months of an ileostomy where I had a stoma, tiny piece of my small intestine was brought outside of my body, and I wore an appliance over it to catch stool. After the J-pouch was healed, that was reversed. So everything is sewn back up, tucked back inside. And then now I go to the bathroom out my bottom again, which I have for the past 22 years now. So that's my story in a nutshell.
So it sounds like life for you today looks, different than it did, 25 to 30 years ago when you were just learning about, what this means for you and how life is going to look like.
Right. And being diagnosed so young, I was 16, I didn't have a concept of what life with a chronic illness would look like. And there was much less understanding, much less information available, fewer options for support during those days. So it was impossible to know almost sort of what to expect or what the trajectory was going to be like. And there wasn't anyone that could tell me what that was. I did know that there was a risk of colon cancer associated with ulcerative colitis, and that did concern me. And then, ultimately that's where my path may have been headed at that time had we not done the colectomy. But yeah, before I had the colectomy, we're talking, going to the bathroom 20 times a day, sick all of the time, fatigued. I would come home from work. I did manage to hold down a job at the time, but it would come home from work, crawl into bed, get up the next morning, do it all over again. Surgery was a vast improvement on my quality of life. And during the time since I've had my surgery, I've gone on to build my career and have 2 children, get married, and have a much better quality of life than I had in those 10 years while I was living with the ulcerative colitis.
And so how has your experience kind of going through this, these earlier years with, lack of support and lack of information, how has that informed the way that you now provide support and information to other people who are living with IBD?
Right. Well, so much has changed. There are so many more treatment options available. And in the United States, we had the passage of the Affordable Care Act. One thing that happened to me was that I went without insurance coverage for a time because I had a pre-existing condition. And if you switch between jobs, things like that, I had, extenuating circumstances where I was paying for things out of pocket as much as I could. But things like colonoscopies are prohibitively expensive if you don't have insurance. So all of these things, plus my diagnosis journey, which was not a long one. I talked to many patients who have a diagnosis journey that takes years, sometimes even decades. They look back and they realize when their symptoms started. So today I try to provide support for people to help them understand what their treatment options are and how they can be beneficial. And then also, because I had these experiences where I was subjected to periods without having insurance and without having the care that I needed, I also do some activism work in the IBD community, in the digestive disease community, in order to help people understand how they can continue to advocate for themselves and their community so that we don't have to go through these things again and that people can receive the healthcare that they deserve.
And gosh, that's so important. There's this, it really is a journey of identifying what's going on with yourself, getting the care you need, and then also taking that next step to inform other people in their journey and to provide information within that space. And I'm really curious if you could tell us more about some of the advocacy work that you do with moms, with IBD moms.
Right. So I had J-pouch surgery when I was 26, and I began trying to plan for a family when I was in my early 30s, after I was all healed up and ready to go. And then I began learning about the things that I would need to do to get my body prepared for a pregnancy and for a healthy birth, and to keep myself healthy as well. And I, even at that time, I always say, I've never met another person like me in the wild. I've only ever met people who live with an IBD or who've had J-pouch surgery through essentially my work or through networking or through support groups or online. And when I had my surgery, we knew a lot less than we know now. They told me what could possibly happen, but nobody could tell me if or when or how anything would go in the future. They did the best that they could to preserve my fertility during my surgeries, and we sort of went from there. So several years into my mothering journey, I met the crazy Creole mama, who is Brooke Abbott, who co-founded IBD Moms with me. And as we got together and we were talking, I realized how much of our journeys were similar, and then also how we sort of powered through. We didn't really know what to expect, what was going on, who to talk to, what we needed. Excuse me. And so we thought to ourselves, there have to be so many more moms out there like us that just don't even know what we don't know. And we realized that we had been so used to doing things on our own and so used to finding information and advocating for ourselves when we could have been looking for a community, forming a community, and helping other people who are starting on their parenting journey. And so that's why we got together and we founded IBD Moms. Today, we have a closed Facebook group where moms can come in, and moms-to-be and moms of kids who live with IBD can come in and ask questions in a safe space. We regularly go to Capitol Hill, well, in pre-pandemic times, and now virtually. We work with the legislative staff there for our representatives to help them understand what people with IBD need and what people who are going to embark on a parenting journey with IBD need. So we advocate for in those ways. And we also provide support in whatever way we can. Sometimes it's a little bit ad hoc. We have a mom that reaches out to us and needs a particular thing, and we will connect them with the resources that they need to go on their parenting journey safely and with everybody being healthy and as happy as they can be.
It sounds like you've created this place for people to receive support and then also adapt, the type of support that you provide to people just based on that need.
That's exactly right. Yes.
Yeah. And I'm curious, you have these mothers to be who are maybe stepping into this with a whole range of questions. What are some of the most common questions, or maybe the most common question that you will get from mothers within this space of IBD, and just looking forward to, what parenthood looks like?
Sure. I think the biggest thing and the first thing is that we have to look at the initial misconception, which is that people with IBD either can't become parents or shouldn't become parents. That is a thing that has persisted. We still meet people today who have been told by their healthcare providers erroneously that they either shouldn't or can't get pregnant. And yet people with IBD become parents all of the time and do so safely, and everyone does well. So that's the very first thing, is that hopefully you are looking for information and finding it if you've been told that you can't become a parent and you have IBD. So that's the first hurdle to get over. One of the next hurdles is to understand how you prepare for a pregnancy. That's extremely important because we call this the rule of thirds. So when you have IBD and you get pregnant, a third of women do well, a third of women experience a flare-up, and a third of women are the same as they were going into it. So you want to go into your pregnancy as healthy as you possibly can be, and that means getting into remission. So that goes back to what I experienced, in that I went to my healthcare providers and I made the rounds of all of my specialists and said, hey, it's time. And we went through a period where we had to fix some things and tweak some things and figure it all out. And in my case, that took years. Hopefully it doesn't take that long for other people, because we know so much more now than we did when I started on my parenting journey 15 years ago. So that's the other thing. And then once you are able to become pregnant, how do you continue your treatment? And I say continue because we also think of pregnancy as a time when people need to stop taking everything. I mean, they tell us not to eat soft cheeses. They tell us not to eat certain lunch meats, all sorts of things. And some things are appropriate. You don't want to drink, you don't want to smoke. But that also tends to make people think that maybe they should discontinue their medications. And that is not always the case. In a lot of cases, you're going to want to continue your medications through pregnancy. And there has been some incredible research done over the last decade or so that shows that it is important to continue your medication through pregnancy, and that it helps everyone be healthier, and that the babies are born and they do really, really well. And that there really hasn't been any safety signals with most of the medications that are used to treat IBD. But when you are embarking on that parenting journey, that is a question that you need to work through with your providers as to what you're currently doing, if that's going to continue to work through your pregnancy, and if there's anything that you should tune up or tweak in the meantime. So these are some of the really, really big things that we see. And then after that, of course, everyone's parenting journey is different. So that's why I talk about it gets a little ad hoc after that. Are you bottle feeding? Are you breastfeeding? You're going to need different support in those circumstances. And then just the day-to-day, it gets wild. Especially with a newborn. And so then we just, a lot of times we try to provide as broad a spectrum and information as we can, but then also to help moms meet their individual needs and where they are and what they're looking for at that particular time.
And something that's so important that you're alluding to here in this whole process is that of self-care, learning what, how you take care of yourself first to be able to, care for others. And in this scenario, becoming pregnant, having a child, and being able to take care of a family in that way. So really coming back into your own, your own process and your own journey, what have you found to be helpful for you in that self-care process? How do you take care of yourself?
Mm-hmm. It changes over time because kids aren't static. So, it changes along with the changing needs of the kids. I think overarching and something that everyone can learn, and I think people with IBD in particular need to learn and need to come around to, is asking for help. That is the very, very first thing, is to reach out, ask for help, and then receive it also when it is offered. So that's first. That goes over everything else. For myself, I'll tell you currently, and I've tried lots of different things for self-care. It's not always bubble baths, but sometimes it's a bubble bath. But it also means attending regular doctor's appointments, making sure that I receive my medication on time, making sure that I'm taking whatever supplements my physicians have recommended for me, getting the vaccinations that they recommend for me. That's all part of self-care, so that I am as healthy as I possibly can be, to be there for my family and to also have the best quality of life that I can have. And it's funny because I was talking to someone the other day, and I was talking about my mornings and a morning routine, which includes, getting kids off to school. But part of my morning routine also includes some time for myself. And that can look like, on a day when the weather cooperates, that can look like going outside and going for a run. That can also look like some time on the stationary bike or strength training, things like that. And also because I listen to a lot of podcasts, so that's also part of my self-care time. The headphones go on. I have what I call sort of my moving meditation, and that level sets me for my entire day. If I miss it for whatever reason, because I have an early morning meeting or something like that, my day doesn't go quite so well. So I also think self-care is one of those things that you do have to work at and try to incorporate every single day. And so that is something that I include for myself every single day. And it's just of the spectrum of things that I have tried. For me, it just seems to be the best way to work it into my day, work it into my life, and then also sort of get the most benefit for the time that I'm putting into it.
Something to emphasize in what you're saying here is that it's a learning process, right? It's a skill. Self-care is a skill, identifying what your need is and then taking that action to fulfill that need in whatever way it looks like.
And for sure, I've tried things that didn't ultimately resonate with me, and I had to leave them behind. So there are things that work really well for other people, and I tried them and it didn't work out for me, and that's okay too. Is to recognize when something you're not really getting the benefit out of it that you expected, and giving it your best shot and still saying, this wasn't the thing for me, and so I'm going to move on to something else.
Yeah, or even the thing for me at this time, because again, like you said, needs change over time, so at least having those tools in your toolkit, is one way to look at it, and being able to pull out that tool at the right time that can serve you best in that moment.
Absolutely.
And so just in our remaining minutes here, curious if you would be able to share any recommendations for, for the IBD person who might be listening into this and just feeling like their battle is overwhelming and feeling like they're not quite sure what to do? What advice might you offer to that person?
The first piece of advice, and this is going to be the most difficult, is to become your own fiercest advocate. And that is something that you learn over time. And as parents, I think about this a lot in that I will completely go to the mat with someone over my child, if it's something that my child needs. But I don't always do the same thing for myself. So we have to look at it that way. How would you advocate for someone whom you love fiercely? Okay, that person should also be you. You love yourself fiercely, and so you will do the things that you need to do to advocate for yourself. So that's the first thing, and that will serve you in so many ways, not only in your journey as a patient, but your journey in life, everything else that you do. The other thing is that you need to make sure that you're taking care of yourself, and part of taking care of yourself means being educated about your disease. And so that it's a time investment, and that's kind of a tough thing. And it also means sort of thinking about your disease, reflecting upon your disease. And there's lots of times when we would just prefer to not. We just want to live our lives. We want to be like the people that are around us. We want to be like our peers. But it is important to be educated, because educated patients do better. So that can mean going to patient advocacy groups and working with them, volunteering with them if you're so inclined, or even just receiving the educational information that they provide. That also goes back to being your own fiercest advocate. You ask your physicians, where can I learn more? Am I doing the right thing? Do I need to see you more often so that I can get some of my questions answered? What do things look like in 5 years, 10 years? Asking questions like that. About what we call your prognosis. So what your disease is going to look like, which I had no inkling of when I was diagnosed, but we know so much more now. And these are the questions that you can get answered. So those are the two things that I would tell people: be your own best advocate, and then also educate yourself as much as possible about your disease.
And what I'm also taking in from this conversation here is a thread of hope that is there. You've said this a number of times, that there's so much more information today than there was 30 years ago when you were going through this. And so the information is there, and to just be your own advocate and to learn all that you can about, what it is that you're going through.
Right. And things change. Things that we thought were true, or that people thought were true some time ago, are different today. And our understanding of treatments and new treatments are coming along all of the time. It's pretty fantastic, because when I was diagnosed, and then during the 10 years before I had surgery, there was not a lot going on. So when I see today that we have this medication pipeline that is extremely robust, and there's so much coming, and that's something that patients can learn about too, and can understand, and can know where, the direction that treatments are headed in. And then also there's so much research now that I used to feel like I could keep up. I feel like I can't keep up anymore. There's just so much coming all of the time. I love it when people let me know about new research, because I can't keep up with it. And that even when I attend medical meetings to cover them as a journalist, sometimes it means choosing between two different things about IBD, because they're at the same time at the meeting, which is incredible. That means that there's so much information that like you can't even take it all in. So it's a really wonderful, very, very hopeful time for people with IBD. And even for those that are newly diagnosed, I hope that you can understand that there is so much available to you, and so many treatment options, and so many new choices, that you can live a great quality of life even while you're managing your IBD.
Well, on that positive note, Thank you so much, Amber, for being here with us and sharing your insight and your wisdom.
Oh, it's my extreme pleasure. Thank you so much.